Is everybody else good in about 30 seconds-ish?
Yeah, about 30 seconds or so.
Sounds good.
We're still in toning right now.
It's still going.
Yeah, toning's still talking. I think they're gonna switch with it. Is it going to switch over?
Yeah, Andrew, yes.
Okay. Let me call him quick. Do you have master control number?
Yeah.
Can you call them and tell them we're ready to start here? My phone sucks.
I believe we are on air.
Oh, okay.
Never mind things, bye.
We're all good?
Yep.
Alright, good to go.
Welcome everyone, happy Friday. I hope you are having a great week. As always, I'm Jen Rumbolski and I'm from the health department, and as always I will give an update on the case numbers, and then I'll give a few other updates, and then we have a special guest today that I'll be able to introduce in just a moment. So first of all, our case numbers at the Wisconsin level at present, which just came out a little bit ago here, we have 1,916 cases in the state of Wisconsin. That is up 186 cases from yesterday. So we do continue to climb in that about 180 per day in the state. We also have 487 individuals in our state hospitalized. That is up 26 from yesterday and is about 25% of the total cases. There are 37 deaths, and that is an increase of 6 individuals from yesterday, so we are sorry to hear about that. And there are 22,377 negative test results, which is up about 2,060 from yesterday. For La Crosse County numbers, we have one additional case that came in this morning. This is in a young female who is in her upper teens, and she did get COVID-19 through travel history. She had been in Florida a couple of weeks ago. So that brings our total up to 20 individuals in our county that have lab confirmed cases of COVID-19. Again, that's an increase of 1 from yesterday. We have 14 now who have recovered of those 20, and that's an increase of 1 recovered from yesterday. And we now have just 1 individual who is in the hospital. 1 individual has been able to go home, so that is good news. And we continue to have 0 deaths in La Crosse County relating to COVID-19. So as we have talked about in the past with regards to the strategy, the overall strategy that we're following to assure that we're reaching the goal of decreasing the number of deaths and illnesses relating to COVID-19, those strategies include prevention, which is about preventing La Crosse County residents from getting COVID-19, identifying and limiting the spread, which is secondary prevention, detecting cases of COVID-19 early and preventing the spread of disease, and improving outcomes, which is priority number 3, improving the outcomes of La Crosse County residents who contract COVID-19. In alignment with this strategy, today we have a special guest who will talk about mental health, which I think we could argue crosses all of these priorities in our strategy, particularly when we think about all of you out there and all that you're currently doing to stay at home, wash your hands, social distance, and help us decrease the spread of this virus. This is difficult, and there are a lot of changes in our lives right now. So for all of you, mental health is a very important topic. In addition, when we think about those that get diagnosed with COVID-19, certainly that is also a very unique mental health experience. And also for those that are caring for all of the individuals that are either suspect or have confirmed COVID-19, all of our healthcare workers, all of our frontline workers, which includes daycare providers and grocery store clerks, and individuals that are helping to support us to be able to have the essential functions that we need to continue staying in our homes, mental health is very, very applicable. So at this time, I'd like to ask Sarah Johnson to come up and introduce herself and share with you her mental health message. Thank you, Sarah, for being here.
Thank you, Jen. Hello, everybody. I am the mental health director at the Crosse Area YMCA, and I am, it's strange to say, happy to be here, because of course this is a really difficult time for so many of us, but I am happy to be able to provide some information that I think is so vital for all of us right now. Mental health is how we think, feel, and act. How we think, feel, and act. And if you can think about the last few weeks of your life, have you seen changes in how you think? Have you seen changes in the way you feel? Have you seen changes in the way you act? I think probably every single one of us on this globe can answer yes to that. Anxiety is a very normal reaction to what we're experiencing on the globe right now. Uncertainty and change is difficult for us, even in small ways, and we are facing something that none of us have ever experienced before in our lives. Because of that, you may notice difficulty concentrating sometimes. You might notice getting angry or frustrated sometimes. You may find yourself having difficulty toning down the worry or falling asleep at night. All of these would be normal reactions, and really, really important then that you are responsive to that. So if that's happening for you, it's really important to know that there's lots of things that we can do to respond effectively to those things. As we take a look at how we take care of ourselves, so how do we take care of our body and our container, right? Our container contains all of our contents, our brains, our hearts, our guts, our hopes, our dreams, our fears, our memories, all of that's contained in our container. So the way we treat our container is going to be extra doubly important right now. So thinking about how you move your body. Movement can really help tone down some of the chemicals in our system that make us anxious and that have an impact on our immune system. It can also increase the chemicals that help us feel better. The way we rest our body, and thinking about if we're moving our body more, we probably need to rest and fuel our body more. You may find that your energy is low as your body is trying to help you make sense of a new situation in this world. And so really working on how do you fuel your body with the right amounts of food and the right types of food that help your mood and help you feel the best. We also want to think about boundaries. How do we set healthy boundaries for ourselves? And that's going to be in a lot of different ways. So right now we're practicing what we call social distancing, which is actually just physical distancing. We're putting distance in between ourselves so that we are reducing the risk of transmitting the virus. That has a cost, though, on how we feel, because as humans, we are social creatures. We really need to lean on each other. And while we cannot physically lean on each other right now, we can emotionally lean on each other, which means reaching out to the people that you love, connecting with them virtually, calling them. There's a thing that we used to do in the past where you write on a piece of paper and you put it in an envelope and you send it to someone you love. That's something we can do again today. So what are the ways that we can creatively reach out to the people who are important to us? It's also really helpful for our mental health to do things that are meaningful and to behave in ways that are congruent with our values. Right now, knowing that every person on the planet is experiencing challenges, and some of our neighbors and community members even more so, it's absolutely imperative that we work together to cultivate a community of calm. And when I say cultivate, I mean create that calm, because right now most of us probably aren't feeling calm just in our day-to-day, and that's okay, that's normal. So we need to intentionally do the things that are going to help calm our system. Taking deep breaths in and out like that can really help. And so doing all the kinds of things that can help your system calm down, all of the strategies that you use on a typical day are going to be even more important to do now. We also want to be bringing compassion to the world. Compassion and kindness are going to be so important because we know so many people are struggling right now. So at the YMCA, we have a number of resources that I want to share with you, and there are going to be more resources coming. Currently, on Fridays at noon, I'm doing free webinars on managing anxiety and taking care of yourself. I invite any of you to join with us. It's a great way to have conversations about how to cultivate that calm. We are also going to be launching a dinner table resilience series that will be coming in the next week or so, and that will be bite-sized pieces of activities that you can do around your dinner table to help support your mental health and the mental health of the people that you love. You can also find all kinds of resources on our webpage. So if you go to laxymca.org, you will find our virtual Y, where we have virtual exercise classes now, fitness classes that you can do at home with your family. We also have a section on mindfulness and mental health resources. That has information not only on how to care for your mental health, but it also has the videos and the webinars that we've been doing already, as well as our mindful minutes. All of those are things you can do in your own home. You also might find inspiration on Better Together's Facebook page. Better Together is an organization in La Crosse that is helping promote mental health and really trying to help everyone in our community be as well and thrive and be as resilient as we can be. So I'm going to encourage everybody right now, since I'm standing here with you, to take a nice deep breath in and out with me. That's going to be important to keep doing that as this continues. Thank you for your time.
You guys, Sarah Johnson is one of my absolute favorite people in this community, so it's great to have her here, and I couldn't give her a hug, but I thought about gratitude as she spoke, and hopefully you thought about that too. I'm really grateful for Sarah and for others in our community who help us with these kinds of tips, and I'm looking forward to those dining room table little nuggets that we can talk about with our family. So these are the ways that we can join together, and I'm grateful for that. I'm also grateful for many of you. I hear such positive comments about how our health department is operating, and I even got a card, one of those little, you write on something and you put it in an envelope and you mail it. I got that from, I think, an 80-year-old woman, and maybe she's watching today, and I just want to say thank you. I also heard from my nurse, who was the school nurse where I went to high school. She sent me a card as well, and of course I remember her too, Jackie. So thank you to all of you. Gratitude goes around for sure. Before I take questions and answers, I did just want to mention that in the midst of this pandemic situation, next week is actually National Public Health Week, and we sent a press release out about this earlier today. So it is ironic to find ourselves celebrating National Public Health Week in the middle of a public health crisis, but it's also quite appropriate. And I think and I hope that you have learned a lot more about what public health does for its residents in the community every day. There are health departments across every county in the state of Wisconsin and across the nation, and we do important work, and I just think that often it's silent work, and yet we just tirelessly work all the time to try to help make communities better and healthier. And so I just want to talk a little bit about the themes with regards to National Public Health Week to get you thinking about different areas that public health and health in general touches our lives. So the first one is mental health, to advocate for and promote emotional well-being, and we certainly have tried to bring that to you today. Next is maternal and child health, and that is about ensuring that the health of mothers and babies can be healthy throughout the lifespan. Third is violence prevention, so working to reduce personal and community violence to improve health in our communities. Then environmental health, and this is about protecting and maintaining a healthy planet. Education, making sure that we have quality education in schools. That is really critical to the health of individuals. Healthy homes, so where we live, being affordable and safe so that we can be healthy in our homes. And that's, I just want to mention here that is why we look upon those that are unsheltered or homeless with a special consideration, because those are individuals that don't have healthy homes to go to. And so we have to help raise up everyone in our community to be healthy. And economics, to advocate for empowerment as the key to a healthy life. So those are the themes for National Public Health Week. So I encourage you to join us in celebrating that next week. With that, I will take questions and answers. Or questions, I always say questions and answers.
Why is a time like this so imperative to really pay attention to your mental health and to really more or less keep yourself kind of healthy in this kind of situation?
So why is now the time to pay attention to mental health? You know, I think we are in unprecedented times, and when we experience change like we're experiencing now, we lose some of that level of control that we may be used to having in our lives. And when that happens, we find ourselves in a situation that we aren't comfortable with. And we have to think about what tools and resources we have available to us, and we might need to ask for help. And that can be really hard to do for many of us. So I think we have to pay attention, first of all. We might be noticing changes in ourselves, like we're a little bit more irritated, or we might be feeling angry, and we haven't really attributed that to a change in mental health and why that might be happening. So I think noticing that is the first step. And then I think reaching out to get support and guidance and assistance is the next.
There's been some research as far as COVID-19 being spread via talking and breathing. Also, as a result of that, kind of wearing headbands or other kind of protection around your mouth when you're going outside. Is that something that you ascribe to, or what do you think?
So the question is, there has been some research about the spread of the virus happening from talking and breathing, and we do know that the spread of the virus happens from droplets, and that can occur through talking, through coughing, things like that, where we're expelling droplets into the air. And that's why we talk about that 6-foot distance and social distancing, so that usually that would not travel farther than 6 feet. When you ask about the guidance around wearing something on your mouth or nose or face, particularly when you're maybe out in public, we are hearing some about that. There is not yet a specific guidance that has come out from the Centers for Disease Control, for example, but if and when it does, we will certainly be willing to talk about that and help guide the public as well.
For healthcare workers who kind of wear those kind of plexiglass shields, are those reusable or washable in these instances?
So the question is, for healthcare workers who wear the face shields or the plexiglass see-through shield, are they washable or reusable? And yes, I believe that they are. There are guidance documents for healthcare workers specific to all personal protective equipment, including face shields and masks. And that can vary from when you have no shortage to when you are in a shortage to when you are in a crisis and have no materials. So healthcare workers and healthcare facilities are continuously assessing their level of personal protective equipment stock and then addressing the guidance relating to what their stock looks like.
And do you know what that stock is at Mayo or Gunderson?
So the question is, do I know what that stock is at Mayo and Gunderson? At this time, we are hearing from our healthcare partners that they are okay with personal protective equipment. That's what we're hearing.
Some stores such as Menards and Target have sort of may have stricter guidelines now. What are your thoughts on that? Is that something that you think that other stores should really be following now, as well, as far as limiting people in and out?
Thank you for that question. So the question is that some stores like Menards and Target are now placing some limitations on individuals that can come into the store. So I heard about Menards not allowing individuals, I think under the age of 16, coming into the store. So I think that is a really good practice to have. We have been saying all along that these trips to those kinds of stores should be for essential reasons, and only people who are essential to go, meaning the person that is actually making the purchase, should be going. So we don't want to see younger children in the store with their parents or their guardians for obvious reasons, because we don't want to see them have the potential to be exposed to COVID-19. So I think these are definitely wonderful practices that we're seeing from these stores, and I would encourage that to continue.
How could that help protect people who are working there too?
So the question is, how could a practice like that help protect people who are working there too? So this goes both ways, right? We can have where someone might be coming in who is sick, who is actively coughing, and if that is a child, and they haven't been tested, for example, there are individuals, we know there's community spread, so there might be individuals that aren't being tested right now that might have a cough, and whether that is COVID-19 or something else like influenza, first of all, it's not healthy for them to be out and about. I mean, they should be home, recovering, getting fluids, resting, but also they could then be spreading whatever it is that they have with others in the stores. And these are essential workers for us. We need these folks to be there to help us get the essential items that we need from those stores, including groceries. So I think it does go both ways.
Sort of wrapping up week 2 here of the Safer at Home order, what are you seeing with that, and do you think it's working currently?
So wrapping up week 2 of the Safer at Home order, do we think it's working? I think it is working. I think that without this order, we would be in a very different place. We already in our state are seeing almost 200 cases per day being added to that list. We see hospitalizations, we see deaths in our state. We do not want to see deaths in our state. We don't want to see people hospitalized with COVID-19. So I think that the fact that we already have some of those means that this order is really important, and that we would have had more. I would predict if we didn't have this order in place. It's really an important order. I think it makes a big difference for decreasing the spread of the virus, knowing how the virus spreads. And I think I just continue to reiterate how important it is for every single one of us to be following that practice. And it's really specific to include not getting together with your family other than your household members on Easter for dinner. I spoke with my mom this morning and told her, we're not going to be having Easter dinner. That's not happening this year. And she said, I know. So that's hard stuff. She already purchased 2 hams. So I get that, but I think we all have to be in this together, and that does take compromise and sacrifice from every individual.
With the increase of positive case numbers, we're also seeing an increase of negative case numbers. How is that maybe some positive news?
So the question is, we see both an increase of positive and negative numbers. What does that tell us? What do we take from that information? So there are a lot of negative case numbers. And so how we look at that is, we still have a tiered structure for testing. We still don't have where everyone can get tested. So those are the individuals that most need the testing. So if we have that many negative tests, I think that is helpful to understand the percentage of those that actually turn out to be positive. And that percentage is about half in La Crosse County as it is in Wisconsin, but it could be worse in both locations. So I think that is good news to know that a pretty significant number of individuals are testing negative.
Has that percentage of positive tests gone up or down statewide, or either in La Crosse County?
So the question is, has that percentage of positive to negative tests gone up or down statewide? So I've done a calculation maybe every other day to figure that out, and I didn't do that today. I think it's generally been in the 6 to 7% of all cases are testing positive for the state. I might be wrong in that, but I think that's what it's been, and we've been about half of that, at about 3%. So I can verify those numbers and correct that on Monday if need be.
That 19-year-old that just has been our most recent case, I guess you said she went to Florida a couple weeks ago. Did she just start showing symptoms within the last week? I guess, is there a chance that she might have accidentally, without really realizing it, kind of had some spread throughout our community or communities?
So the question is, the most recent case that we had, is there a possibility that that individual has been symptomatic and in the community? We're currently working on figuring that out right now. So we've been in contact with that individual and are conducting that investigation right now. And as I've said before, as soon as we know if there are individuals that have been in contact, in close contact with that person, they'll be the first on the list to get a call from us to let them know that. And then, of course, if that person has been symptomatic and in a location recently, that would also be something that we would want to make our public aware of. So we're going to let folks know as soon as we know more about that.
If elections do get moved to later in May and become mail only, can you explain whether or not COVID-19 could spread via mail paper ballots?
So the question is, thinking about elections, could COVID-19 spread via mail paper ballots? So we do know that on certain surfaces, that virus can hold on for a while. At this point, the research that I've seen in regards to paper has been 24 hours. So I can look at that again, but I think by the time something got through the mail, it would no longer be infectious if there was a viral material on there.
Maybe just back one more time to the stores. Do you guys at all regulate or talk with them about how they're implementing certain things, like only letting in people of a certain age or that?
So the question is, do we speak with stores or regulate in any way, the practices they're using, such as only letting in certain individuals? So we're in the middle of this right now, actually. We developed a tool that we're going to be speaking with store owners or store managers or operators and asking them what are they working on now and giving them some recommendations about other things they might consider doing. And all of that is to try to encourage those stores to take all of the right precautions to protect the public, their customers, and their those that work for them, their employees. So great question. Looks like that's it for questions. Thank you so much for tuning in today. Have a great weekend, you guys.
Thank you.